job. So I'm going to talk about Liraglutide and Metformin. So what it is. See what happens. Tell me, sugar is good for you or bad for you?
Good and bad.
You know if
It depends.
how does it depend?
The too much amount.
So what happens if you have zero sugar? You will be dead, right? So you need some sugar to be alive. But if it's too much, what happens?
Fat.
You need these two things.
Diabetes.
You need these when you have too high sugar. So that's diabetes. So these are the medications used for diabetes. Alright? So these are my favorites. So I'm going to talk about why is it my favorite.
Insulin?
It's not insulin? Okay. So let's start with the introduction.
Next.
Alright. So we are going to talk about liraglutide, metformin. And before that we talk about what is diabetes. The types, how many types there are, the main types, and how do we treat it? Okay, so basically we are going to talk about these four things. Treatment ideas, metformin and liraglutide. Try to remember it. I know it's difficult, so be awake. Okay, now what is diabetes? When your blood sugar goes above a limit, it's called diabetes. It can happen at any age. So the definition is the limit. If it's above the normal limit, you have diabetes. So if I check my blood sugar, I may be diabetic. It's not written on my face. Okay? So it's a very common disease. 1 in 10 Chinese have this disease. Okay? And don't forget, like, large population of them are children. So we exclude them. So we are just talking about the adults. In this case, we are talking about the total number of people that are in China. 1 in every 10 is diabetic. India used to be the leader in diabetes. Used to be. Now it's overtaken by China. Okay? So, and it's also one of the top 10 leading causes of death in the world. And the figures we are seeing here is the tip of the iceberg. Okay, before we go further, let's try to understand what happens. This is a very important organ which is responsible for controlling your blood sugar. Okay? By secreting something called insulin, natural insulin inside your body. So whenever the sugar level goes high, the body orders the pancreas, this is the organ, so it's located somewhere here, there is the stomach, and there is this turn of the intestine. So in this curve, this organ is located. Okay? And this is called pancreas. I don't know the Chinese term for this. So this is the relative location. You can see it's behind the stomach, right? So can you see the other image? So this is the organ which creates insulin, some special type of cells which are present in this organ. And so there are two things which happen with these cells which secrete insulin and which cause the disease. So let's see what happens. Okay, there are many types of diabetes. So we are just trying to talk about type 1 and type 2. The most common one is type 2. 90% of the diabetes are type 2 diabetes, which happen in adults. And type 1 diabetes happens in children. The mean age of diagnosis of type 1 diabetes in children is 5 years old. Can you imagine 4 and 5 years old kids have type 1 diabetes, which is more dangerous than type 2. And imagine kids love eating sugar and chocolates and cookies. How will you stop them? So that's a big challenge for the parents who are unfortunate to have that kind of disease. So now let me explain you. Very simple. It's not difficult. Type 1. What happens is, we were talking about the pancreas, which was present in the area of the stomach, right? That pancreas is responsible for secreting insulin, which controls your blood sugar. In type 1, what happens, there is some genetic problem, and that cell is not able to secrete insulin. So whatever you eat, whatever sugar you eat, and don't forget, every food has sugar. Some has more, some has less. Whatever you eat is going to collect in your blood, is going to collect in your blood, and that raises the blood sugar. And there is no insulin to order the muscle cells or other cells in the body to take up the sugar from the blood. And the baby is always in problem. they're always tired, they're always dehydrated, sick, and parents think they're growing, babies are supposed to be irritable, so they don't diagnose up to the age of 4 or 5 years. When kids are really problematic, they go to the doctor realize, okay, it may be diabetes, looking at the symptoms, and they check the blood sugar, it's 400, 500.
Oh.
They have been living with that figures for 4 or 5 years. So that's the problem with type 1. Only problem is the cells which are supposed to release insulin is not releasing insulin. That's the only problem. Type 2, there are 2 problems. One, the main problem is the body cells, the muscle cells of the body, they are not listening to insulin. So there is sugar around, insulin is kicking, hey, take the sugar, hey, take the sugar. They are like, no, why will I take it? This person doesn't work out, man. I don't need sugar. I don't need energy because this person is not working out. He's watching television whole day, eats a lot of food. They don't need my energy, the muscle cells are not being used. So why do I take sugar from outside? So the insulin comes and orders the muscle cells, take the sugar from the blood. They're like, no, we are not going to take. So it's like resistance. There is resistance to insulin. Your body stops taking sugar because it's sugar all-time high, The sugar is all-time high. And your body says, no, I don't need it, leave it. So that's like insulin resistance. That's the number 1 problem. Okay? That's why doctors tell you, do exercise, do some gymming, running, frisbee, whatever. Okay? That's why they tell you, because your muscles and the body cells which are supposed to be working out and needing sugar, they start attracting sugar because now they are in real need because suddenly you started walking and exercising. Right? So that's what. Okay. And the second problem is what was with type 1. The cells stop secreting insulin. The cells which were responsible for secreting insulin stop doing that. So there are 2 problems with type 2. Okay? Alright, so I hope you got an idea. And how dangerous is diabetes? Many people say diabetes is the king of diseases. If you have diabetes, you don't control it, you will be in trouble in next 5 to 10 years. Not today, not tomorrow, but next 5 to 10 years, big trouble. So what can happen? It can damage your kidney. Your kidney function will be gone. You'll go to washroom every 5 to 10 minutes. Your filtering problem will be, you have neuropathy, which is the abnormal sensation in your legs and pain and kind of abnormal feeling. You can have strokes, you can have heart attack, and yes, they are a good friend with hypertension, so both of them can do a lot of damage together. Peripheral artery disease, which is blood vessel disease, it can make you blind as well. So it is recommended to check your eyes every year if you have diabetes. Glaucoma, diabetic foot. So diabetic foot is something you get injury in your foot and it doesn't heal. It keeps on increasing. One day you have to cut your toe. So that's what it does. Okay, that was the gist of it. And see, the figures we were talking about was just the tip of the iceberg. Because many people, they don't even know they have diabetes. Because it doesn't create any significant symptom like fever, or you're just on the bed and you might feel lethargic, weak. You may have dizziness sometimes. So you think, I'm tired, so I got to rest and things like that. And you don't even get diagnosed if you don't go to the doctor, do a routine check and things like that. So a large part of it is already undiagnosed. Okay. So 30.3 million with diabetes in the US, that was 2017. 84.1 million with pre-diabetes, very close to diabetes or undiagnosed yet. They don't have any clinical symptoms. Okay, now let's talk about the treatment. What do we do with the treatment part of diabetes? When you talk about the treatment, the first thing we talk about is lifestyle. I don't have to say what is lifestyle. All of you know. So lifestyle is the first thing that is advised. If your blood sugar is like borderline high kind of thing, okay, you don't go right away with the medication. And then we have medication, list of it, which were tried and used and failed. They looked after the long-term complications, the side effects of cancer and things like that. So there is a big list of it. The problem with most of the drugs were, they used to cause hypoglycemia. Hypoglycemia means low blood sugar. So what happens if an old person, say 70 years old or 50 years or 60 years old, they're not old, I'm sorry, so like 60, 70, they have lightheadedness, hypoglycemia, they fall down, they break their hips. Falling is a big problem in older population. Or they fall down, they get head injuries. Sometimes they even die of hypoglycemia because they don't know what's happening. They just avoid, and sometimes, so hypoglycemia was one of the side effects of all the medications. And another side effect was weight gain. See, the more you have weight gain, the more you're at the risk of diabetes. So the hope is gone, like you will be treated ever, because the side effect is weight gain. And if you're gaining weight, you're getting more appetite, you feel like eating more and things like that. So there were many side effects, and finally they found a drug, which is an old drug, and over the years they have studied a lot and finally found this medication can do a lot of good. And this is my personal favorite. And most of the doctors, they start with this medication when you find a patient with diabetes. The benefits are enormous. Like one of the best part about it doesn't cause hypoglycemia. You don't get hypoglycemic episodes. You lose weight with this medication. Your appetite goes down. You don't feel like eating. Your absorption of the sugar from the stomach decreases. So if I'm eating like 10 grams of sugar, 5 or 6 grams will go out, and 4 grams or even less than that will be absorbed, because it inhibits absorption of sugar in the stomach. Okay? So there are many other benefits which comes with this medication. The only side effect that was noticed and argued about was the abdominal discomfort. Some people can have pain with this medication in the stomach, may have nausea sometimes, and feel like vomiting kind of thing, but very less population, like 4% of the people who have been using it. So that was it. And this is the other one which I was talking about, Liraglutide, only approved in 2014 by FDA, very recent drug. And it looks like insulin, but it's not insulin. Insulin is insulin, which was supposed to be secreted by the pancreas, will be given from outside. But one of the important side effects of insulin is it causes weight gain. And a person who are trying to lose weight, they cannot lose because insulin does significant weight gain. Okay, and this is amazing because this is kind of smart drug. It knows when your sugar is high. It knows when your sugar is high, and then it starts its action. And the chances of low blood sugar is low because they sense it. They know like blood sugar is very high now, we have to be working now. And then they shoot up the action. That's why it's spatial. And also it controls your appetite and things like that. It causes weight loss, significant weight loss. And also it is used as weight loss drug kind of thing. Okay, so we have a question answer session, right?
Oh.
Can I take 2 minutes from there? Is it 12 minutes already?
10 to 12.
Yeah, 12 already.
It's over?
Yeah.
Okay, good. Okay. So if you want to ask something, okay, it's done. So those were the benefits actually. Right. Insulin is an old kind of thing. So prevention is better than cure, and the only thing was these are favorites of many diabetics and doctors around the world. So that was the message. If you have any question, just one question, you can go for it.
So,
Yep.
as long as we have a healthy lifestyle, we can avoid the diabetes.
Yes.
You promise?
Okay. So if I have a family heritage of diabetes, does it increase my possibility of
Yeah, it
getting
does.
that? And how do I prevent that? Or
By decreasing, it needs two things. One is genetics, the other is lifestyle and the environment.
One is what?
One is genetic, like your parents, the
Oh.
hereditary gene. The other one is your lifestyle. So if you can stop your lifestyle and risk factor, you can easily prevent it.
so I can prevent it or just postpone it?
You can prevent it. If you postpone it up to 90 years, then it's good enough.
Sounds good.
Right. Okay, thank you very much for your time and sorry for the interruption.